Hi everyone. Here, respiratory problems in newborn and aged individuals. Respiratory problems in newborn. There are infant respiratory distress syndrome, sudden infant death syndrome, asphyxia neonatorum. First one, infant respiratory distress syndrome. It's also known as hyaline membrane disease because hyaline means is glossy or transparent. So these membrane look like a glassy. So it is called a hyaline membrane disease. When there is not enough surfactant, tiny alveoli collapse with each breath. When alveoli collapse, damaged cells collect in airways, which make harder to breathe. These cells are called hyaline membranes. It is the commonest cause of neonatal mortality. Then RDS occurs primarily in premature infants. Neonatal respiratory disease system is more common premature babies born in 6 weeks or more before their due date. It usually develops within the first 24 hours after birth. Then their lungs are surfactant deficiency. Surfactant deficient means surfactant means a surface active complex of phospholipids and proteins. Then this surfactant lowers surface tension and thereby prevent alveolar collapse during exhalation. Its main cause is surfactant deficiency, and genetic order disorders also cause fatal respiratory distress syndrome. Abnormalities in surfactant protein B and C. Here we can see normal alveoli and collapsed alveoli. Its signs and symptoms include tachypnea. Tachypnea means it's a condition of rapid breathing. Then nasal flaring, refraction, grunting. Nasal flaring means it occurs when nostrils widen while breathing. It's also a sign of trouble breathing. Then grunting. Grunting means a sound can be heard each time when person exhales. Then cyanosis, diseased air entry. Then sudden infant death syndrome. It's also called crib death. Sudden infant death syndrome it's an unexplained death, usually occur during sleep. It's also called crib death because infant die in their cribs. 6,000 to 7,000 babies die of SIDS every year in US. Almost SIDS death occur without any warning. It also have both physical and sleep environmental factors. Physical factors include brain abnormalities, low birth weight, respiratory infection, etc. Sleep environmental factors include sleep with stomach oci, soft surface with the parents, etc. So, we can ensure the crib is properly assembled. Always place baby on his or her back to sleep. Keep a smoke-free zone around your baby. Use a blanket sleeping. Never use loose blanket. Keep baby in mom's room but in a separate sleeping area. Use a firm mattress. Remove everything other than the mattress and sheet from the crib. Do not overclothe baby. So we can protect child from SIDS. Third one, asphyxia neonatorum. It is defined as an imbibed respiratory gas exchange. It's accompanied by development of acidosis. Acidosis means it's a buildup of acid in the bloodstream or overproduction of acid. It interrupts umbilical cord blood flow, failure of exchange across placenta, inadequate perfusion of maternal side of placenta, failure to inflate lungs, etc. Then respiratory problems in old age. Respiratory problems in old age mainly include pneumonia. It is an acute infection and inflammation of the alveoli of the lungs. So, pneumonia occurs, it is an infection in lungs, it's caused by microbes. It brings water into lungs and it make it difficult in breathing. It is caused by when immune system is very weak or organism is very strong or body fail to filter the organism. Factors that predisposes to pneumonia: cigarette smoking, alcohol, old age, corticosteroid therapy, upper respiratory tract infection. Then we can prevent pneumonia by vaccination, frequent hand washing, healthy diet, physical exercise, and to give up smoking. Then other obstructive lung conditions include buildup of naturally occurring mucus, disruption of support of tissue around airways, tightening of the ring muscle around airways, thickening and hardening of the walls of airways. Thank you.